Marketing technology, healthcare costs philosophy, ancestry, and LLCs. Today's episode has got a lot to see. So stop right there. Don't pull up your chalks because today's episode is with Larry Block. Check it out. Everybody wants to talk, but nobody wants to listen. So here's my petition. Instead of division, let's make our mission to change the system. Learn how the world works. Learn how we can act. Welcome, everybody, to the Justice Podcast. So today I'm talking with Larry Block, and we actually met via Lunch Club. Somehow, if you want to sponsor us, that would be awesome. Except I don't even know how you get money, so I don't know if you're really spending marketing dollars. But yeah, we met on Lunch Club, and I heard a really interesting story from Larry about how he made some certain business decisions related to the Affordable Care Act back in the day. But before we dive into that, I would love to just get an intro with you, Larry. Tell us a little bit about what you do. What kind of business do you run?
Ultimately, I run a marketing business. For the last 26 years, I have had a marketing company. It started as a package design company, and over the years, we've evolved and pivoted, and now we do everything from websites to texting to QR codes, NFC chips, direct mail. I mean, you name it, in marketing, we do it. We tend to outsource the traditional social media and that kind of stuff, and we do everything beyond that. That's why our company's beyond the Outbox. We go beyond that traditional email and media marketing and take it one step further. We do cutting edge design, and we do a lot of get into operations as well, because we do the text messaging, and especially now with the NFC chips, we're able to affect how businesses actually run their business and help them become more efficient and better customer service through texting that evolves off the marketing.
And can you explain that technology, the NFC chips?
The NFC chips you've probably seen on the business cards these days. You run into someone and you can tap your phone, and their business card information will transfer to your phone. That's the simple NFC chip. I first saw it in action here in Atlanta. I went to the College Football Hall of Fame. They give you a badge with your name on it and a chip. So as you go through the exhibits, you can actually participate in the exhibits. And at the end of the show, based on that chip, they'll upload it into the cloud, so you can actually download videos of yourself participating in the College Football Hall of Fame. As I said, that's where I first saw it. What we've started to do is take it beyond. As I said, you see people where they'll tap their phones and the business card information will go. Well, our latest thing, last couple of weeks ago, we did a campaign where we sent out a direct mail piece with NFC chips attached to each postcard. Each NFC chip was categorized with the address and name of the person it went to. And when they were able to tap their phone to that postcard, they then got an interactive video showing more about the product and service, as well as a call to action where they could actually buy it right there on the spot. We had a tremendous response. Our first send out was 1,000, which is a very low number, but we got almost 1,100. We got 110 people that actually clicked on that video. And now we've done the massive mailing of 25,000. So I'll let you know what those results are when we get those back.
Sounds good. But as you said, you've been doing this for 26 years. I'm sure you've seen all sorts of ebbs and flows within the industry and even within your own company. What has the evolution of your business looked like over time?
Um, Early on, the evolution was driven by my customers. When I started my business as a package design customer company, I had two major customers, one of which I lost after 4 or 5 years, as tends to happen because of evolution. And that company actually got bought out by a bigger company, which had an in-house art department. So that's when I got lost. And at that point, I was tired of doing the same thing over and over and over for the same client. So I was looking for ways. When I had to figure out new ways, I went for business that I like to do in industries that I wanted to do. And then was the turn of the century. So the websites were coming up, and we got into the web design, as did every other graphic design company back then. Our probably claim to fame was in 2004. I got married in Ireland, and we saw text messaging there that the US still hasn't caught up to what we saw. And so in 2005, we started a side business called Mobile Marketing Technologies, selling text message marketing to the business world. We were one of the first to market. By 2009, the text messaging business was bigger than the graphic design business, and that's when we merged it into Beyond the Outbox. And from there, we got into apps and have always looked at the cutting edge technology to see how we can actually make it work instead of just make it fun.
And so how big was your team when you were doing all this?
Um, at one point, and a lot of it has changed, but probably between 2000 and 2005, I probably had about 15 to 20 people working under me. Um, back then, things have changed. Back then, I had to have all kinds of equipment. We had to actually make films to do printing plates, things like that, that we no longer have to do. So some of that changed, and we don't no longer have to do the production that we used to have to do back in the day as well.
We talked before about how when the Affordable Care Act was passed, you had to adjust a little bit, or you had to reconsider the employees that you had. Can you discuss that a little bit?
Yeah. Yeah, I mean, when suddenly, as a small business owner, I was small enough that and not making so much that I could um, give my employees benefits as necessary, health care. We made it, we put them in touch with people so that they could get the benefits, but we as an employer weren't big enough and could not supply that. And when the Affordable Care Act came through, and suddenly we were going to be required to do certain things and a whole lot more paperwork and everything else, we had a meeting with us, with the accountants and the attorneys, our attorney, and came up with the idea that it would be a better model for us based on what we could provide and what we were bringing in to outsource. And so we brought the business down to just me and my wife as the owners. And now we outsource anything we need instead of hiring employees. We'll hire people on a temporary basis, on a project by project basis, but it's basically all outsourcing.
And so did you continue using the same people? It was just now 1099, or did you go to other
Yeah,
people?
yeah. Um, Some yes and some no. For the most part, we would use the same people, but during that same time, such websites as Fiverr and some of these other type places came up. So now when I need a specific thing, if someone doesn't fall right in, exactly what I need, I can go find it. It gives me a lot more flexibility where in the past, if we suddenly had a new project doing something new, we had to teach somebody or figure it out ourselves or, you know, do that learning curve, with the people here where now we can reach out and find someone who might already have knowledge in that. So it's helped both sides, in a couple of different ways. It's helped us expand somewhat.
So you've expanded because you don't have the obligation, but because you effectively let those employees go, or is that
I Yeah, we effectively let the employees go, but what we provided, because my dad's an attorney, so we provided the services so that they could become their own businesses, so that they could get started and treat us treat us as a client and also go get other business. So we looked at it as a win-win for everyone, with the exception of one or two employees. All of our other employees are doing well and seem to be very thankful that we gave them the push up.
so would it be fair to say people appreciate or they like the flexibility, or what would you say that
Yeah.
they how would they assess this?
Well, you have to realize when I hired employees, I always wanted self-starters. I always wanted people that were in effect part-time. I encouraged them to find, freelance work elsewhere as well, because my feeling is when they're working for other people, they're getting other perspectives and they're bringing more back to me. Um, and I had a very good relationship with my employees. It was not employee, more as colleagues. Um, so when we made this move, we were very transparent and discussed it with all of them. And, basically we were, most of these people are in, and I was too. I remember when I was working at night, trying to do freelance, trying to decide, okay, when am I going to quit my job? When am I going to do something else? So we gave them that opportunity.
And so when did you decide to go out on your own?
I went on my own. I was running an art department in the through 93 to 95. I was running an art department for a company that wanted to pay me hourly instead of putting me on salary. Um, I was actually looking to go out on my own probably the end of 1996, but in January of 96, I got called into this to my bosses, and they said, looking at our payroll, you account for 75% of the payroll in the art department, because I was having to work so much overtime and all this, and they wouldn't put me on salary. 6 months before, I had gone to them and said, if you put me on salary, it makes more sense. And they said, no, everyone's on whatever. So we agreed that at that point that I would leave. I actually resigned, was the agreement, because I didn't want it on my record that I got fired. Um, and as such, I took a bunch of their customers with me. Um, the company I worked for, what they made was printing plates for flexographic printing. And that was their main job. They had an art department, as I said, 15 to 20 people, because their customers would send art in that didn't work and had to be converted so they could make the printing plates. So they didn't care that I took the customers, because they knew I was going to provide them with what they wanted. that they that it would go through their system and they would make their money and they didn't have to deal with the headaches. So it was actually a win-win for both of us. And to this day, I'm still on friendly terms with that company and the family that runs it.
And bringing it back to the healthcare aspect, I'm assuming as a self-employed individual, you just have your own employer's healthcare, or how does that work?
Yeah, yeah. I'm on a not on one of the affordable care plans, but we have a family plan through private insurance, which made more sense for us.
And you can answer this or not, depending. I don't want to get, dive in too much into your personal details. Um, but how did you go about selecting your plan?
Through an agent, through actually, through networking and um, you know, my agents through US Healthcare. They shopped the plans for me and came up with what made most sense for what we did, what we needed.
And do you think, is that what other people are doing as well, like the contractors now that you work with? Or do you,
Yeah, I mean,
okay.
for the most part, as I said, if you go to some of these other networking events, I do Happy Neighborhood Project a lot, and you'll see a lot of the healthcare people in there that, and even through LinkedIn, I get hit up from all kinds of people in the healthcare industry, trying to get us better plans and manipulating the system as everything changes. I look at them to be on top of it to find what's best for us. Um, though I am looking for someone that is what I'm particularly looking for is someone that is I want a consultant that can look at my plans and make sure that I'm not missing something. In other words, I have my mom's in memory care facility, and my father-in-law is 88 years old. They have decent or very good health insurance. I know that, but I want to make sure. I want to know what I'm missing, like when's she eligible for a new wheelchair? When's she eligible for a new bed? When do we get that through our insurance so we're not um, missing some of these benefits? And that's what I can't. My healthcare agent, all he wants to do is they want to find us new plans that will give us what we want. But I want someone to look at my existing plans and say, hey, you could be getting this, or you're eligible for that.
Because you feel like, or maybe your experience is not that the health insurance is going to tell you themselves.
I know they're not. My mom's in a memory care facility, and a few months ago they called and said her wheelchair was broken. Well, because of something that happened a couple of years ago when she had gotten her wheelchair, we had gotten it actually through Medicare or Medicaid, one of those two. And when I finally called them and spent a couple hours on the phone, we realized that she's eligible for not only a new wheelchair, but a new bed as well. That every 18 months that on her plan that she can get a new mattress. So, I'd like to take advantage of those things instead of having her sleep on a lumpy mattress. Wouldn't it be nice to get a new one? She can't complain.
Yeah. How is that? I mean, do you handle all of your mom's healthcare kind of planning at this point?
No, I do not. Like I said, she's in the facility. We've turned most of it over to them and follow, when they need something, they'll let us know and we'll provide it. Um, but they're too busy to go through everyone's policy and figure out, okay, though that wouldn't be a bad perk for one of these retirement communities to have someone on staff that would go through and let them know when they're eligible for what.
Yeah. So what would your solution be? You're a business guy. How do you think this should work?
Well, I think that there's a potential for a business in there that someone could be a healthcare consultant that would literally go in and look at the plans and figure out these kind of things. And also it would be an independent consultant that could let them know whether they have the right coverage or not. Not someone trying to sell them a new policy, trying to get them to switch or do this, but to say, this is what's covered, and these are what your needs are.
Interesting. So if any of the listeners out there are looking to start a healthcare business, this
Yeah, I mean,
might be your in.
yeah, I mean, the best businesses come from problem solving, and to me, that's definitely an issue and a problem. And there's an awful lot of baby boomers in retirement communities right now that could probably be taking advantage of this.
So shifting back to your own businesses and all the things that you do, because you do so much, can you explain to the audience what karaoke is?
Karaoke is an event that we put on. It's actually in less than 4 weeks. It's in the Atlanta, Georgia area, actually in Kennesaw, Georgia. What we do is at the local airport, we empty a hangar out. We pull the nose of an airplane in and wrap a stage around it and have about 600 people in the audience and randomly call 40 people up to sing karaoke. And what we're doing is raising money for the firefighters. Last year, we raised $12,000 during COVID, had 350 people show up. This year, we're expecting over 600. And I think we're going to raise between 40 and 45,000 this year.
That's awesome. That's a good amount of money.
Yeah. Yeah. I mean, like I said, everyone's jumped on board. We've gotten all kinds of sponsors. We're guessing about $15,000 in silent auction items to auction off.
Wow. That's really great. It's awesome. That's great what you're doing for them. I'm sure they really appreciate that. And it sounds like a fun time as well.
Yeah, it really is. We had a ball last year. It was a whole lot of fun.
Well, as our final item, I've got a dad joke of the day. All right. Okay. Why was the dog sitting outside the hospital for the entire day?
I don't know.
It was a patient dog. All right. That's all I got for today. Larry, I really appreciate the time today to chat and just get a little insight on your business and even just how the Affordable Care Act has affected some of the decisions you've made.
Well, thanks. It's been quite a pleasure being on.
All right, Larry, have a good one.
You too. Thanks a lot.
This isn't financial, legal, or medical advice, but we do discuss how we might invest our resources for a healthier society. If you'd like to learn more about today's topic and other public policy issues, check out the website, thejusticepodcast.com.